So what that is I'm just going to be looking at some of the structures in your mouth. I'm just going to be looking around inside of your mouth a little bit. But while we go throughout this, I will let you know exactly what we're doing beforehand, what I'm kind of looking at. And if you have any questions throughout the process, you are totally free to just ask any questions that you have. Any questions to start?
No.
All right. Okay, before I'm just going to put on my glove here. All right. So first, I'm just going to be looking at your face while you're just at normal rest. I'm just looking at the symmetry of your face. That looks good. Can I have you open your mouth for me? Okay, good. Okay, and can I have you smile? I'm just going to look at your teeth. Good there. All right, okay. And now can I have you close your eyes, and I'm just going to try to push and do some resistance on your eyelid a little bit. So I'm just going to try to pull up your... Good. Did you feel any discomfort at all while doing that? Okay. Perfect. Okay. Okay, now I'm going to be looking at your lips. Can I have you pucker your lips like a fish? Okay. Okay, and then can I have you smile? Okay, thank you. All right, and then can I have you say ooey, ooey, and move your lips back and forth? Ooey, ooey, ooey. Okay, perfect. Thank you. All right, can I have you say mmm, mmm? Okay, and then can I have you do it one more time for me? Okay, and I'm just seeing if there's any airflow coming outside of your mouth. Can I also have you puff up your cheeks like a fish? Okay, there we go. See if there's any air leakage there. Okay, perfect. Okay, and then can I have you smack your lips together 5 times for me? Perfect, everything looks great there. All right, now I'm going to be looking at your jaw a little bit. So can I have you open your mouth? Okay, and then can I have you close your mouth for me? Okay, perfect. All right, now I'm going to put on my other glove, and I'm just going to, it's called palpating, and I'm just going to touch the outside of your jaw just to make sure that all the muscles around your jaw are working together as they should be working. Okay. So I'm just going to briefly touch you. Can I have you clench your jaw for me a little bit? Everything seems very, very good. Okay, can I have you stick out your tongue for me? Okay, good. And then can I have you move your jaw? We're going to move your jaw from side to side. Okay, perfect. Okay, and then can you move your jaw forward for me? There you go, and then move it backward. Okay, perfect. All right, and then can you stick your tongue out for me one more time? Okay, good. Can you move your tongue from side to side? Okay, good. Now you're gonna get your tongue and can you push your tongue up to the hard part of your mouth? Okay, and can you put it down to the bottom of your mouth? Okay, good. And then can you stick your tongue all the way outside of your mouth and can you move it up and then move it down? Okay, perfect. Your tongue looks really, really good. And then we're gonna put the tongue at the very top of it's called the palate up there. You're gonna put it up there and you're gonna pop it off that and make like a clicking noise like. There you go. Yes, very good. All right. All right, and then I'm going to have you get your tongue outside on your lips, and I'm going to have you move your tongue from side to side on your lips and kind of lick your lips.
Do you want me to do both sides?
Yes, on both sides. Perfect, thank you. All right. Now I'm going to have you puff out your cheeks again like a fish like we did before, and I'm just going to briefly put my hands on both sides of your cheeks, and I'm going to try to push that your cheeks together, and I want you to kind of resist it a little bit and try to keep me from pushing all the air out of your cheeks. All right? Very good. Okay? And then I'm going to have you push air on one side of your cheek and next and just rotate back and forth. Okay? Okay, very good. And then I'm going to do the exact same thing, push some resistance on both sides of your cheeks. All right, and the next one. It's very good. All right. Okay, now I'm going to use the light here and I'm going to kind of look at the inside of your mouth now. I'm going to start by just looking at your teeth a little bit, make sure everything's looking good with your teeth. And then I'm going to look at your tongue as well. And then we're going to use the tongue depressor. I'll kind of explain what that process looks like. All right, perfect. And then can I have you stick your tongue out for me? All right. Okay, now this is called a tongue depressor. This is going to help when I'm looking at the different parts, like your soft palate, it's at the very top of your mouth. I'm just going to be looking at that to see if it drops and raises. To do that, I'm going to put this on your tongue and I'm going to press your tongue down a little bit so I can see the back of your mouth. Let me know if there's any discomfort or anything during this process. All right. All right. Okay, and can I have you say "ah" for me 3 times? Okay, perfect. All right. Okay. All right. And while I was doing that, I was also looking at seeing if there was any nasality in your voice at all. And I didn't see any of that, so very good. Okay, and then I'm going to use the tongue depressor again, and I'm going to put the tongue depressor on your tongue, and I'm going to have you push up, and then just kind of the same thing as the cheeks, the resistance, and then we're going to do it on both sides of your tongue as well.
Okay.
All right? Okay. Push up. Stick your tongue out. We're going to go on this side first. To your left. Very good. Go to your right. Very good. All right. Okay. Now I'm going to be using a little cotton swab here, and I'm just going to be touching different parts on the inside of your mouth, just so we can look at your sensory part of your mouth, see if you can feel the different parts that I'm touching.
Okay.
All right. Feel?
Mm-hmm.
You feel all of that?
Yep.
Okay, perfect. And then I'm going to use a different one. And I'm going to be doing the same thing, but on the different features of your face. The same thing, we're looking at the sensory part of your face. All right. Okay. And then real quick, we're going to be using the tongue depressor again. And I'm going to be looking at a gag reflex on this one. So it might sound a little scary, but it's really not. I'm just going to put this at the back of your mouth towards your throat.
Okay.
And then as I move down, I'm looking for the gag reflex. So you let me know if you feel if you want me to stop, or if you feel any sort of pain or discomfort while I'm doing this. All right?
Sounds good.
Okay. Okay, perfect. All right. Okay, now I'm going to be looking at your voice. So for this, I'm going to have you say certain sounds for me.
Okay.
We're going to start with saying "pa," and we're going to do this 16 times.
Okay.
All right? Okay.
Pa 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 pa.
Okay, perfect. Now we're going to do the "t" sound. And we're going to do that 16 times as well.
Ta 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 ta.
Okay, perfect. And now we're going to do the "k" sound now at the back of your throat. And we're going to do that 16 times as well.
Ka 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 ka.
Okay, perfect. Okay, now we're going to do "pata." We're going to combine the "pa" and the "ta" sound together, and we're going to do this one 12 times.
Okay.
All right?
Pata 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 pata.
Perfect. Good job. Yes. Okay, and then we're going to combine all 3 of our sounds together now, and we're going to do "pataka." And you're going to try to do this as fast as you can.
Okay.
And we're going to be doing this 8 times.
Okay.
Okay?
Pataka 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 pataka.
Perfect. All right, and we are almost done. So to finish up, can you just cough for me? Okay, perfect. And then can you also clear your throat for me? Okay, perfect. All right. Everything looked super, super good in the oral mech. I didn't see anything of a concern. Everything seemed within normal limits. Have you had any concerns lately? Anything?
Not that I can think of.
Okay.
No.
Do you have any questions at all for me?
No.
Okay, perfect.
Thank you very much.
Thank you.